So my practice philosophy consists of interactive decision making and offering natural options for any health challenge. When people have been to the traditional medical approach, they very often have been scanned and x-rayed and laboratory tested, and they come in to me saying, well, we want an alternative approach to this, or a holistic approach. The first things that I look at alternatively, number one is nutrition, and see what their diet is, and we typically do nutritional testing like the SpectraCell test to get a sense of how antioxidants are and specific micronutrients are. We look at toxins. We'll look at the body's consumption of certain toxic foods, or if they have had toxicity through heavy metals or toxicity through chemicals or allergies. We also look at hormones. Sometimes it's about balancing the hormones, not treating a hormone dysfunction, but about optimizing them. The hormones we look at, male and female hormones, adrenal hormones, and thyroid hormones. And basically with hormones, we take the approach to optimize health as opposed to just treating a medical condition. Many patients feel improved when we optimize hormonal levels. When we find that the issue is toxins, the first source is the GI tract. It was to change the diet and to avoid consuming toxins. For example, we find that people that eat a lot of fish sometimes get exposed to mercury, and we can check for mercury in the blood. If the elevated levels of mercury show, we can basically say, well, where are you getting it? Is it from your dental amalgams? Is it from the swordfish or tuna that you're eating, or is it from the place that you work? It's very important that we find the source of the toxins that we're trying to get rid of. The next step is to get rid of the toxins, stop the exposure, and then to pull them out. The removal of toxins, specifically heavy metals, is called chelation therapy. We can do this through oral chelation, meaning taking supplements that pull out heavy metals. That's very good at pulling it out of the gut and pulling it out of certain foods. So let's just say you're a big fan of salmon or swordfish. If you eat a diet with that, a salad or a lot of rough fish and fiber, when you're eating that fish, you're going to consume and assimilate less of the heavy metals associated with that. You can take a supplement like garlic or cilantro that may help pull out heavy metals from the GI tract as well. If the metals have been already assimilated in your tissue, well, then you'll see that level in a blood test, or we'll see that in a hair analysis. The blood test is an instantaneous level of heavy metals, and most specifically we check for lead and mercury. And the hair test is a long-term body burden. We can also do a urinary test for heavy metals. If the levels are elevated, one of the treatments besides dietary and supplemental chelation is intravenous chelation therapy. We use a chemical most commonly that's called EDTA, ethylene diamine tetraacetic acid. So it's much easier to say EDTA. But in a nutshell, EDTA is a chelator. It grabs or claws onto heavy metals and doesn't let go on them, and then it's filtered out of your blood into the urine and out of your body. Pulling out heavy metals is twofold effective. Number one, we remove the oxidative challenge and the chemical catalyst that causes the poisoning, so the lead or mercury gets removed. Number two, when we're doing the chelation therapy, not only is the EDTA in the solution of intravenous fluid, but there's high dose vitamin C and there's typically B vitamins associated. So we give nutrition to the body, and we give vitamin C, which is a scavenger of free radicals and helps your body heal and repair. So heavy metals cause free radical production and cause inflammation and damage. EDTA binds out heavy metals, and vitamin C helps the repair that the body uses to an antioxidant to repair the damage that mercury or lead could do to the system. People ask me, how often should I do the chelation therapy? We figure that out on a case-by-case basis. Depends on how long the mercury's been there, depends on how high the level is, and if there's any health issues associated with it. The most common and shortest course of chelation therapy is usually about 12 sessions over 12 to 24 weeks. If somebody has acute symptoms, we may treat longer than 12 sessions. And we have many patients that have had chronic health issues that have treated for 60 or 70 or 80 infusions over many years. Each case is determined specifically upon the patient's needs.